How to reduce nighttime urination naturally. Nocturia relief. Tips. Have you ever found yourself stumbling to the bathroom in the middle of the night, half asleep, wondering if your bladder secretly signed you up for a marathon? If you're getting up more than once or twice a night to pee, you might be dealing with nocturia, the fancy medical term for nighttime urination. But don't worry, you're not alone, and this isn't some bladder rebellion you have to accept. Today, we're going to break down why this happens, what you can do about it, and how to reclaim your sleep. Why am I waking up to pee so much? First, let's clear one thing up. Waking up once in a while to use the bathroom is normal. But if your bladder is treating the night like a full work shift, something's up. Here are the most common culprits behind nocturia. 1. You're drinking too much before bed. Let's start with the obvious. If you're chugging a liter of water right before you tuck yourself in, guess what? Your bladder is going to demand a midnight meeting. Try limiting fluids at least 2-3 hours before bedtime. Pro tip: if you must drink something, go for small sips of water rather than gulping down a big glass. 2. Caffeine and alcohol, the troublemakers. Caffeine and alcohol are like those friends who promise you a good time but leave you with regret. They increase urine production and irritate the bladder, making those nighttime trips even more frequent. Solution: skip the late-night coffee and limit alcohol in the evening. If you're craving a warm drink, try herbal tea instead. Just make sure it's caffeine-free. 3. Medications that keep you running to the bathroom. Some medications, especially diuretics, aka water pills, literally make you pee more. If you take them at night, well, you see where this is going. If you're on meds that could be affecting your urination, talk to your doctor about adjusting the timing. Common culprits? Diuretics, used for high blood pressure or heart conditions. Certain antidepressants. Calcium channel blockers. Lithium, used for bipolar disorder. 4. Diabetes and blood sugar issues. If you have diabetes, high blood sugar levels can pull water into your urine, causing you to pee more frequently, day and night. If you're suddenly peeing a lot and feeling extra thirsty, it's worth checking your blood sugar levels. 5. An overactive or irritated bladder. Sometimes your bladder is just too sensitive. Certain conditions like overactive bladder syndrome, bladder infections, or even bladder stones can make you feel like you have to go even when your bladder isn't full. If this sounds like you, a doctor's visit is in order. 6. Aging and hormones. As we age, our bodies produce less antidiuretic hormone, ADH, which normally helps us retain fluid at night. With less ADH, your kidneys keep making urine, and your bladder gets no rest. Ladies, if you've hit menopause, the drop in estrogen can weaken bladder control, making nighttime urination even more of an issue. For men, an enlarged prostate can be the root cause. How to stop waking up at night to pee. Now that we've uncovered the suspects, let's talk about how to put your bladder on a better schedule. 1. Manage your fluids wisely. Limit liquids 2-3 hours before bed. If you get thirsty, take small sips instead of gulping. Cut down on caffeine and alcohol. Switch to herbal teas or warm milk if you need a bedtime drink. Keep a bladder diary for a few days. Track how much you drink and when you pee. You might spot a pattern. 2. Elevate your legs before bed. Sounds weird, right? But if fluid is pooling in your legs, which happens if you sit or stand for long periods, it can shift back into circulation when you lie down, sending your kidneys into overdrive. Try this. A few hours before bed, put your feet up on a pillow or against the wall for 20-30 minutes. It can help your body process excess fluid before you sleep. 3. Take a nap in the afternoon. Naps aren't just for toddlers. If you're on your feet all day, a short 20 to 30-minute nap can help your body redistribute fluids, reducing the amount of urine produced at night. 4. Strengthen your bladder with pelvic floor exercises. If your bladder is easily triggered, doing Kegel exercises can strengthen the muscles that control urination. This is especially useful if you've had children or are experiencing bladder leaks. How to do it? Squeeze the muscles you use to stop urine midstream. Hold for 5 seconds, then relax. Repeat 10-15 times 3 times a day. When to see a doctor. If you've tried these lifestyle changes and are still waking up multiple times a night, it might be time to talk to a healthcare provider. Red flags to watch for: sudden increase in nighttime urination, burning sensation when peeing, could be a UTI. Blood in the urine, swelling in your legs or feet, sign of heart or kidney issues. Extreme thirst or unexplained weight loss, could indicate diabetes. A doctor may recommend urine tests to check for infections or diabetes. Blood tests to evaluate kidney function. Bladder scans to see if you're emptying fully. Final thoughts. Let's get you sleeping again. Nocturia might be common, but that doesn't mean you have to accept it as your new normal. A few simple changes, like watching what you drink, elevating your legs, and strengthening your bladder, can go a long way in helping you get a solid night's rest without those annoying bathroom trips. And remember, if something feels off, don't ignore it. Your body has a way of sending signals when something needs attention. So, listen to it, make adjustments, and reclaim your sleep. Question for you. How many times do you wake up to pee at night? Let me know in the comments. And if you found this video helpful, don't forget to like, subscribe, and share, because sleep is something we all deserve. Thanks for watching, and I'll see you in the next video.